I'm gonna focus on the two categories. One is reasons that they did disclose and reasons that they did not. And I'll talk a little bit about each of them, and I've included a quote from one of the people in this who kind of, that's some of the information how we came up with our categories. Number one for disclosing was to relieve their stress. And one guy said, I decided to tell somebody because I'd been holding it in for so long, and it was not knowing and thinking, I'm going to die. And here you hear what Dr. Monahan was saying early in the epidemic. That's how people thought. But some of these men were still thinking like that. They didn't know about HIV and how they could live with this disease. And you hear here also, they didn't disclose immediately. He said, I decided to tell someone because I've been holding it in. The majority of them waited, and the time period usually was several months to several years. Some were longer, a few were shorter, but most of them did wait before they told someone. Another reason was the need to tell. They identified people that they thought they needed to tell about this disease. One guy said, first and foremost, I told a couple of people that I knew I was going to be sexually involved with, which is good. That's what we encourage. However, most of them did not disclose to casual sexual partners, and that is not unusual if you see the literature on this also. However, they were quick to say, but I use protection. If I don't tell them, I do at least need protection. The need to tell also for family members, usually it was someone that they were very close to or possibly even lived with, so they thought they needed to know so they would understand what they were going through. Another reason for disclosure was to help others. One man said, I know that it is devastating this country, especially African American males and young people, and I play a role in eradicating and educating people. I owe it to my brothers and sisters. So they saw the need to get the word out, to get other people educated. And usually it was about prevention, to help to keep someone else from becoming infected. Another reason was to receive support. I did not have any problem telling my parents because I would know I was going to need them somehow to help me through it. And support, usually it was emotional, could be financial, moral support, but they did need support from other people to deal with having HIV/AIDS. Now, I got more reasons for non-disclosure than I did for disclosure. And most of the data was fear of negative reactions or stigma. One man said, this is actually one quote, there's discrimination, there's stereotypes, there are people somewhat dark, and they'll try to do stuff to you. They really were afraid to tell. And rejection came up over and over. I don't want to be rejected. I don't want someone to turn their back on me if they know that I have HIV. Fear of disclosure recipients telling others. So, as this person said, it's always in the back of your mind that somebody's going to go tell someone else, and then he'll spread it, and your whole business will be out in the street. And there was a lot of that type of talk. They didn't want their business in the street, and their HIV was their business. We asked them if they told others not to tell. So when you tell someone, do you say, don't share this with anyone else? And some of them did, but most of them said, I didn't actually say that, but I assumed this person wouldn't tell. I thought they understood, and usually they did.